Hi, I'm Warren Hammel with Campbell University Physical Therapy, and today we're going to be talking about the posterior tibiofemoral glide to increase knee flexion. The two primary motions of this joint is knee flexion and extension. There are two main components of the joint complex involving the proximal tibia, which is a concave surface, and the distal femur, which involves two convex femoral condyles. So with knee flexion, we'll have it moving up, and because it is a concave moving on a convex, it will be rolling and sliding posteriorly. That's why when we have it down here, we'll be going in a posterior fashion to increase the knee flexion. To have the patient in optimal position, we'll have them supine, and we'll have the knee propped up at 25 degrees of loose pack, close pack position, where most of the rolling and sliding occurs in the knee. So we would first want to stabilize the distal femur, and with the other hand, we're going to find the medial tibiofemoral joint line and wrap our hands around. From here, I will be putting force directly through the joint line in a posterior fashion. With the posterior tibiofemoral joint glide, depending on the grade and the magnitude of movement with the mobilization, we can do multiple things. I'm going to demonstrate for you the 4 different grades of the joint glide and what their uses are for. The first one we'll be going over is grade 1. Grade 1 involves a slight distraction with small amplitudes at the beginning of the range of motion of the joint complex. Research has shown that this is effective for loosening up the joint at the beginning range of motion as well as pain relief. So with the slight distraction, we bring the joint out, and then we will have small amplitude oscillations at the beginning of the range of motion. The second one we will show is grade 2. This involves slight distraction with large amplitudes through the middle range of the joint. This is a very important grade because it increases joint nutrition, it decreases pain, and it decreases swelling. So again, we will have distraction, get it to the middle range of the joint, and then we will have large amplitude movements. The third one is grade 3. Grade 3 involves large amplitude movements through the middle to the normal range of the joint. Research has shown that this is effective for joint stiffness as well as promoting joint nutrition in the joint. So again, we will have distraction, we will get it to that mid to end range, and then we will have the large amplitude movements to increase knee flexion. The final one is grade 4. Grade 4 involves distraction again with small amplitudes at the end range of the joint. This is mainly used to decrease joint stiffness once we've already established full range of motion of the joint. So again, we will have distraction, posterior force to get it to the end range, and then small amplitudes to restore full range of motion and orthokinematics of the joint. Okay, today I have Kristen as my simulated patient, and we're going to be going through the posterior tibiofemoral glide. So upon coming into the clinic today, she has complaints of a little bit of joint stiffness in her left knee, and when I took her through the examination, she was restricted in knee flexion. So I'm going to go ahead and prop her leg up on here. Okay. Are you comfortable, Kristen?
Yes.
Okay, so I'm going to take her leg into the 25 degrees of loose pack, close pack position. I'm going to go ahead and stabilize her at the distal femur. Are you comfortable?
Yes.
Okay, if you feel any pain, just let me know. My other hand is going to come over here onto the medial aspect of the tibiofemoral joint. From here, I'm going to stabilize. I'm going to find that end range. And I'm going to do, because she's having joint stiffness and a little bit of decreased range of motion, we're going to be doing a grade 2 mobilization, which is the large amplitudes through the mid-range of the joint. So go ahead and stabilize, grab, take it through. You have any pain with that?
No.
Okay. I'm going to go ahead and get to the mid-range again. I'm going to do a few oscillations. Research says to go ahead and do 10 to 15 oscillations 3 to 4 times, and then go ahead and recheck the joint. So after we would be done performing this, I would go ahead, take her through the range of motion to see if we gained anything. If we did have no increase in pain or increase in range of motion, then we might try a grade 3, possibly a grade 4 mobilization to increase the range of motion of the joint. I hope this video was useful to you today, and thank you for watching.